Hello viewers, welcome to the Learners Nursing classes. I'm back with the mock test for your exams preparation. Now in this mock test, I will flaunt the question, 4 options. I will read the 4 options, take a pause, give you the right answer and will try to explain why it is the right answer. So let us not delay and start. See, the first question is, a nurse is preparing to give bath to patient who is admitted with perineal problem. Which of the following will help the patient? See, here the question is about the bath. Now answer is, look at the options: bed bath, therapeutic bath, self bath with minimal help, none of the above. See, एज पर दी ऑप्शन, वैसे पेरिनियल प्रॉब्लम में हम जो बात देते हैं उसे कहते हैं सिड्स बाथ. बट इफ इट इज़ नॉट इन दी ऑप्शन, व्हाट इज़ द ऑप्शन अंडर विच द सिड्स बाथ बिलोंग? सिड्स बाथ बिलोंग्स अंडर थेराप्यूटिक बाथ. अभी थेराप्यूटिक बाथ जो होता है, वी गिव फॉर द पर्पस ऑफ द ट्रीटमेंट ऑफ द पेशेंट, एंड लाइक सिड्स बाथ, इट इज़ अ थेराप्यूटिक बाथ वेयर द पेशेंट इज अलाउड टू सिट इन अ टब विद अ हॉट वाटर टू ट्रीट द पेरिनियल इशूज और हीमोरॉइड्स, और वी टेल द एपिजियोटमी लेडीज विद एपिजियोटमी टू सिट एंड टेक सिड्स बाथ. So this is therapeutic bath. Now coming to the next question. In the absence of a nurse, patient falls from the bed. This type of injury belongs to what? See, there are some now looking at the options are battery, negligence, tort, none. So I will tell you the meaning of battery. What is battery? Battery means जब आप deliberately patient को harm करते हैं. Negligence means when not meeting up to the nursing standards, और जितनी we should know and we should give the care. What is tort? Tort is a touching of the patient without the consent of the patient, and none of above, you all know. So here the answer will be negligence. Patient's medical record with all essential information is a responsibility of patient, director, treating doctor, medical superintendent. Postpartum woman having bleeding after 24 hours of delivery, it is called as, when the patient is having bleeding, then it is called as postpartum hemorrhage. But what type of bleeding? मतलब 24 hours के बाद हो रही है, तो primary postpartum hemorrhage, secondary PPH, third stage hemorrhage, true postpartum hemorrhage. What will be the answer? Secondary postpartum hemorrhage. The bleeding that is happening after 24 hours is called as secondary PPH, and the bleeding which is happening within 24 hours is called as primary PPH. In which of the condition the distal pulse is preferred rather than the apical pulse? Now here the options are arrhythmia, shock, hypertension, heart block. So the answer is shock. A preeclampsia woman's baby is lying with the mother, neonate born in 37 weeks. After 57 hours, when the nurse monitored the vital signs of the baby, the temperature is low, 35 degrees Celsius. What will be the intervention? Now let's go to the option. Give punishment for the mother for not carrying the baby, separate the baby from the mother, place the baby under the radiant warmer, cover the baby and check the vitals after 30 minutes. See, here the answer will be cover the baby and check the vitals after 30 minutes. क्योंकि जब हम बेबी को कवर करेंगे तो बेबी का थर्मो रेगुलेशन इम्प्रूव करेगा, बेबी विल कंजर्व द हीट एंड वार्मथ ऑफ द ओन बॉडी, एंड देन वी कैन चेक द वाइटल साइन आफ्टर 30 minutes whether the baby is stable or not. A woman with third day postpartum has complaints of engorgement of both breasts. What is the cut-off temperature for fever in the postpartum woman? Now here the options are 37 degrees Celsius, 38 degrees Celsius, 39 degrees Celsius and 34 degrees Celsius. See, यहाँ पे क्या होगा? 34 तो नहीं होगा, 39 नहीं होगा. What can be the possibility? 37 or 38. So whenever there is a breast engorgement, the temperature will little rise. So the answer will be 38 degrees Celsius. Universal blood donor. So the blood group is O, AB, AB. Now here there are no rhesus factor mentioned कि यहाँ पे नेगेटिव और पॉजिटिव नहीं दिया है, तो यूनिवर्सल डोनर विल बी blood group O. But in case if the option is mentioning O negative, then the negative becomes the universal donor. And same way, AB positive and AB negative, then AB negative becomes the universal recipient. WHO hand wash time with soap. So, what is the time duration recommended by World Health Organization to wash the hand with the soap application? 40 to 60 seconds, 20 to 30 seconds, 2 minutes, 5 minutes. See here the answer is 40 to 60 seconds. Why is it necessary to remove dark colored nail paint before surgery? अब पेशेंट ने नेल पॉलिश लगाया है, उसे क्यों निकालना ज़रूरी है? ऑप्शंस आर नेल पेंट इंटरफेयर विद द SpO2 monitoring and we cannot assess the capillary refill time. To prevent the burn from cautery, nail paint increases the chances of infection. To follow the OT ethics, see here the answer is the SpO2 probe will not be able to sense and we cannot assess the capillary refill time. This is the right answer. Patient with MASA admitted in medical intensive care unit. The nurse has to provide colostomy care to the patient. Which PPE should the nurse use? See here the options are gloves, gown, mask, only gloves, gloves and mask, gloves and shoe cover. See here you should know what is MASA. MASA is a mental retardation, aphasia, shuffling gait. एंड ये जो है ये एक स्पैस्टिक पैराप्लीजिया की बीमारी है, मासा सिंड्रोम होता है. तो देखो अब पेशेंट इज़ विद कोलोस्टमी, तो व्हाट प्रिकॉशन अ नर्स हैज़ टू टेक? ग्लव्स, गाउन एंड मास्क टू प्रिवेंट द क्रॉस इन्फेक्शन एंड टू इवन टेक द इन्फेक्शन, मतलब अपने आप के लिए भी बचाने के लिए. यूनिवर्सल सेफ्टी प्रिकॉशंस के अंडर दिस इज़ पर्सनल प्रोटेक्टिव इक्विपमेंट. सो द लियोपार्ड मैन्यूवर्स आर फर्स्ट, सेकेंड एंड थर्ड एंड फोर्थ. तो इसमें जो द एसेस द फीटल एटीट्यूड ड्यूरिंग एब्डोमिनल पैल्पेशन में क्या होता है? एक्चुअली दिस इज द fourth maneuver. In this, the step determine the fetal attitude and degree of the fetal extension into the pelvis. Now, self-care deficit theory was proposed by whom? See, D. Orams, Rogers, Betty Newman and Liniger. So, the self-care deficit जो theory है ये propose की गई थी D. Orams ने. And this D. Orams has given this self-care deficit nursing theory, which actually focuses upon the rehabilitation and primary care settings, where the patient is encouraged to become independent as early as possible. Patient with anorexia nervosa taking food correctly as per her diet, but there was no increase in weight observed. What will be nursing intervention for the above mentioned patient? Now look into the options. Observe the patient while taking meal and after 2 hours. Increase calorie of the food from 1500 hours to 2000. Add vitamin tablets to her medications. Engage them in other activities. Now here see the answer is, ये हो सकता है कि आपको जो पेशेंट को है, observe the patient while having meal, whether the patient is eating or throwing or there is some error in the history of the patient, and after 2 hours, up to 2 hours, some people have the tendency of eating and then going and vomiting, so this can be also the possibility. What is the difference in regular ECT and modified ECT? See, low volt shock is provided, anesthesia is given, muscle relaxant is given, painkiller is provided. See what is the difference between a regular ECT and a modified ECT. See what is ECT, electroconvulsive therapy. इसमें क्या होता है? You give shock to the patient. So you in modified ECT you induce seizures by giving electrical stimulus. So here the patient need anesthesia. So here the answer is anesthesia is given. All are crystalloids solution except See, normal saline, ringer lactate, 5% dextrose, Hes. Hes means Hes starch. See, all are crystalloid except Hes starch. An antenatal mother is admitted with complaints of eclampsia. What will be the loading dose of magnesium sulfate given to the patient? So, 4 ml in 16 ml normal saline, 8 ml in 12 ml of normal saline, 6 ml in 14 ml of normal saline, and 2 ml in 18 ml of normal saline. See, the dose will be 8 ml in 12 ml of normal saline. Which among measures of dispersion? See, mean, range, mode, median. So here the answer is range, because you know what does range means? The difference between the upper limit and the lower limit. So here, which is among the measure of the dispersion? So here the answer is range. A patient was brought to the emergency department with complaints of chest pain from last 1 hour. Which test is done to detect the myocardial infarction? We do serum electrolyte and check ABG and check CBC and do troponin test. Whenever patient comes, we do all the tests. But what is the marker for the myocardial infarction? See, it is troponin T. Which of the psychiatric drug does not need any test dose before starting the routine dose? See, इसमें से which of the psychiatric drugs do not need any test dose, मतलब test dose की requirement नहीं है. So here haloperidol, risperidone, clozapine and quetiapine. So here it is clozapine. A patient admitted in a ward with the diagnosis of delirium in first 24 to 48 hours, what nurse plan according to priority? Orientation to person, place and environment, to restore bladder and bowel function, correct the wake and the sleep cycle, and to improve the nutritional status. Now, what is the problem in the patient? The patient is diagnosed with the delirium. Delirium matlab lost state of cognition. So here the answer is orientation to the place, person and environment. A patient posted of surgery advised to remove jewelry. Why the patient will be told to remove jewelry? To maintain operating room ethics. It causes burns to the patient with the use of cautery, to prevent theft and to prevent the disturbances to the surgeon. Now here I will tell you, where jewelry can have a metal content. If it is having some metal content, the current will pass through the cautery. The current, when while using cautery, will look for the exit point, and that jewelry can act as an acting point, and the current can get dispersed there, causing the burns to the patient. So here the answer, it causes burns to the patient with use of cautery. At what time ward census done? See, daytime, morning shift, evening shift, none of the above. See, the ward census are always none of the above. See, every ward will have their own census based upon the patient's inflow. So there is no timing for it. So ward in charge and ward sisters will collect the census based on their convenience and whenever they are getting time. Adrenaline dose in anaphylactic shock is 1 in 1000, 1 in 10,000, 1 in 1000 and 1 in 10,000, 1 ml, 1 ml ऐसे 0.5 ml कितना दोगे out of 1? So here the answer is 1 in 1000 and 0.5 ml. मतलब 1 ampule of adrenaline will be dissolved in 10 ml. Then at that becomes 1 in 1000 and उसमें से आप दोगे पेशेंट को 0.5 ml of single dose first as prescribed. Position for patient with continuous RT feed. पेशेंट को राइल्स ट्यूब फीड चल रही है. नाउ व्हाट आर द पेशेंट को कौन सी पोजीशन दी जानी चाहिए? देखो, सुपाइन पोजीशन, फाउलर्स, रिवर्स टेंडलनबर्ग, साइड लाइन. सी, ऑलवेज इन अ RT feed patient may have risk of aspiration. Patient will be given Fowler's position. Normally the enteral feed are flushed with the water to open the blocked tubes and ease the feeding. In which area it is done with air? Neonatal intensive care unit, operation unit, rehabilitation unit or critical care unit. See, answer is neonatal intensive care unit, because the gastric capacity of a neonate is very small, and if you're flushing it with saline, it is the feed will not reach to the baby, and the stomach will be full. And you just to clear the tube, we push little air so that the capacity of the stomach is not filled with the fluid. Flushed. 19-year-old unmarried girl came to Gynae OPD for vaccination against the cervical cancer. Which vaccine will be administered to the client? Now these are Gardasil, TCV, Boxira and HPV. These are all the types of vaccines which are given for the cervical cancers. See here, Gardasil is the vaccine which is for the human papilloma virus, and I will tell you the vaccine, hepatitis B vaccine. This is hepatitis B vaccine. This is not the answer. And Bexiro is meant for the uh, meningococcal infection, and TCV is meant for typhoid. So here the answer is Gardasil. So the right answer is Gardasil 1. Patient in emergency department diagnosed to have a fluid and air present in the lung. What is the above mentioned condition known as? See, the options are hemothorax, hydropneumothorax, hemopneumothorax, pneumothorax. See, now I would like to tell you, hemo means blood, hydro means water, and pneumo means air. Hemo means blood, pneumo means air, pneumo means air. Now patient comes to the emergency department diagnosed with fluid and air. So fluid can be water and air. So what can be the answer? Hydropneumothorax. Lignocaine and adrenaline not used for repair of injuries to the digitalis because the options are adrenaline causes vasoconstriction of the blood vessels supplying the digitalis, which may lead to decreased tissue perfusion and necrosis. Next option, adrenaline decreases the effect of lignocaine. Adrenaline causes systemic effect. Adrenaline causes vasodilation, which may lead to increase in the bleeding. Now adrenaline is a vasoconstrictor. इट विल कंस्ट्रिक्ट द ब्लड वेसल्स. डिजिटैलिस मतलब उंगलियों के एंड में जो ब्लड वेसल्स होती हैं वो बहुत पतली होती हैं, तो जब आप वहाँ पे लोकल विद एड्रेनलिन देते हो तो वहाँ पे वेसो कंस्ट्रिक्शन होगा, तो जो टिप ऑफ द फिंगर या टिप ऑफ द डिजिट्स होंगी उसमें ब्लड सप्लाई कंस्ट्रिक्ट हो जाएगी, विच मे लीड टू डिक्रीज्ड टिश्यू परफ्यूजन एंड द नेक्रोसिस. So here the answer is adrenaline cause vasoconstriction of the blood vessel supplying digitalis, ungliyan, digits, which may lead to decreased tissue perfusion and necrosis. Patient with DVT, deep vein thrombosis, it is advised low molecular weight heparin. At which site nurse will administer this? See, इसमें क्या लिखा हुआ है? Subcutaneous, intramuscular, oral और IV. See, heparin injection, low molecular weight heparin injection जो होता है, that is always given subcutaneously. Now for your information, there is always an air bubble which is present in the heparin injection, which generally people remove before giving, but that air bubble is not supposed to be removed. The syringe is supposed to be held in a 90-degree position, and the needle size is so small that it only goes till the subcutaneous tissue, and the air bubble is pushed along with the injection so that the heparin do not come to the skin surface and causes the discoloration of the skin. Glove papers are discarded in which biomedical waste dustbin? Now see, black dustbin, red dustbin, yellow dustbin and blue dustbin. See, as per the biomedical waste management, the black dustbin belongs to the municipal corporation. Means ये जो house waste होता है या non infected waste होता है वो black dustbin में जाता है, तो the glove wrapper will go into the black dustbin. Biomedical waste management of a vial and a broken ampule discarded in blue dustbin, red dustbin, black dustbin, blue cardboard box. See here, if you see the options, then the answer is blue cardboard box. But if it is an option like blue box या फिर blue puncture proof container, then that can be marked as a correct option. Sharp blades and needle to be discarded in which of the following? Black cardboard, red, white container, blue. See here the answer is white container, white puncture proof container. Vicryl 30 is natural absorbable, synthetic non absorbable, synthetic absorbable, natural non absorbable. See, I will tell you what is Vicryl. Polyglactin 910 is the name of Vicryl. Vicryl is a brand name. It is a suture which is synthetically prepared and it is braided, like जैसे चोटी बनी होती है, that is braided. So it is synthetic and absorbable. So answer will be synthetic and absorbable. Doctor prescribed a child as follows: 50 ml transfused over 10 minutes, drop factor of 15 drops per minute. In 30 minutes, what will be the flow rate? So here the question is asked कि drop factor अगर 15 drops per minute है तो 30 minutes में कितना flow rate होगा 50 ml of fluid का, जो कि पहले 10 मिनट में दिया. So when the 50 ml of fluid is given in 10 minutes, that means that time the fluid has gone in 1 minute the 5 ml fluid is gone. तो इसका मतलब ये है कि 1 मिनट में कितने ड्रॉप्स गए हैं? 5 into 15 ड्रॉप फैक्टर. So that is equal to 75. So that is in 1 minute the 75 drops have been given. Now the question is how much will go in 30 minutes? What will be the flow rate? So option is 20, 50, 25, 30. Here the answer is 25. Now how? See, the formula is volume in ml into drop factor divided by time. So volume is 50 ml, the drop factor is 15 and the time is 30. That is equal to 25. Nurse asked to give 1000 ml of normal saline at the flow rate of 125 ml per hour. How much time will it take to complete this fluid? Now 1000 ml of normal saline will take how much time if 125 ml per hour is given? 8 hours, 6 hours, 10 hours, 12 hours. The answer is 8 hours. Here see 1000 ml of normal saline to be given at the rate of 125 ml per hour. That means 1000 divided by 125 is equal to 8 hours. Nurse on PICU advised to give 400 ml fluid to be given on 8 hours. The drop factor is 60 drops per minute and nurse will run this fluid at what rate? 13 drops per minute, 50 drops per minute, 17 drops per minute, 30 drops per minute. Here the answer is 50 drops per minute. The formula is volume in ml into drop factor divided by time. See, here the volume is 400 ml, the drop factor is 60 and the time is 8 hours into 60 minutes. Like 8 hours, 1 घंटे में 60 minutes होते हैं तो 8 hours into 60 minutes. Here the answer is 50 ml. All of the following are incorrect regarding stoma formation except stoma is created near the bony prominences. Stoma should be created away from the bony prominences. Stoma is created in the lower abdomen in fatty region. Stoma can be done anywhere. All of the following are incorrect regarding stoma formation. इसमें से सही कौन सा है? See, stoma is created सारे ही गलत है, इसमें से सही कौन सा है? See, the answer is stoma should be created away from the bony prominences. ECG of the patient is showing ST depression, prominent U wave and inverted T wave. Which of the electrolyte imbalance it can present? Potassium, calcium, magnesium and sodium. Potassium 2.2 milliequivalent. When the patient is having hypokalemia, patient will show the symptoms of ST depression, prominent U wave, inverted T wave. Patient is undergoing blood transfusion and suddenly patient shows complaints of transfusion reaction. What will be the priority of a nurse intervention? Stop the infusion and remove the cannula. Stop the infusion and flush with normal saline. Complete the transfusion and administer injection AVIL. Complete the transfusion and discard the bag. See here, the first thing will be stop the infusion and flush with normal saline. Inform the specialist, check for the blood reaction form, fill the form about the reaction, and do the needful for the patient. Nurse taking care of a child who is having epilepsy. What nurse should do immediately? Airway management and provide sideline position. Administer oxygen to the child. Do nothing and record epilepsy type and duration. Inform doctor about epilepsy. Record in the nurse's chart. See, whenever there is an epilepsy, there can be tongue falling back, there can be airway obstruction, there can be respiratory disturbance. So what should be the priority of a nurse? To save the patient's life. So what position we give? We give sideline position and we give airway management. So airway management and provide sideline position is the correct answer. What advice should a nurse give to a patient with lithium therapy? Drink lot of water. Take medicine after meals. Take medicine on empty stomach. Take high calorie diet. The answer is drink lot of water. All of the following are sesamoid bone except patella, fibula, calcaneus and सियामेला. तो इसमें आंसर है calcaneus. How frequently will you conduct blood test while patient is on regular clozapine? See, twice a week, weekly, monthly, fortnight. The answer is weekly once. What is key unit nation? See, this is from the research and education. Constitution, law, people, none. People. Injection morphine is given intrathecal during procedure for pain relief. After procedure, which of the following analgesic you will not administer? Paracetamol, diclofenac, tramadol and fentanyl. You will not give fentanyl. Why? Because morphine is an opioid and fentanyl also is an opioid like analgesic. Patient can have overdose of opioid. Patient with anorexia nervosa will have tachycardia, hypertension, hypothermia. Bradycardia, hypotension, hypothermia. Tachycardia, hypotension, hypothermia. Bradycardia, hypertension, hyperthermia. See, सबसे पहले तो जो एनोरेक्सिया वाला पेशेंट होगा ही विल बी ऑलवेज, उसको ब्रेडिकार्डिया भी होगा, उसको हाइपोटेंशन भी होगा और उसको हाइपोथर्मिया भी होगा. Patient is suffering from dyspnea. Which position will you provide to the patient to relieve? Supine, prone, Trendelenburg's, Fowler's. Generally, whenever patient is having dyspnea, it is a normal tendency of the patient or anybody कि हम उठ के बैठ जाते हैं. That is why that position is called as Fowler's position. Answer is Fowler's position. Needle stick injury can result in all of the following except कौन सा नहीं है? See, HIV infection, हेपेटाइटिस बी वायरस इन्फेक्शन, HCV इन्फेक्शन, मलेरिया. तो नीडल स्टिक इंजरी किससे नहीं फैलती है? मलेरिया इज द ऑप्शन. A primary gravida with O negative blood group delivered a baby with O positive blood group while DCT was negative, and what should be done next? See, whenever the mother who is delivering a positive baby, the negative mother is delivering a positive baby, what should we do? Repeat DCT. Give 300 micrograms of anti-D to the mother. Give 150 micrograms anti-D to the mother, and no need to give any anti-D to the mother. We are supposed to give 300 micrograms of anti-D to the mother. Thank you, viewers. Like, subscribe and share.